Wasn't that absolutely wonderful? And I'd like to give Jaime some free advice that maybe he should take Rochelle and give her a violin and say, let's practice. I'm Peter Landless. Welcome again to Maximizing Your Brain Potential.
And I'm Katia Reinhardt, and I'd like to say a welcome to those of you who just joined us online through our streaming, perhaps, or who just walked into this beautiful auditorium. We're here for this third evening, once again, focusing on how we can improve our mental and emotional health.
Yeah, and I think that what is so really important tonight is that there are going to be issues discussed which focus right on where we need to focus. Things that we can change in our day-to-day activities. You know, I'm concerned that things like nutrition, Katya, what kind of nutritional things can change the way my brain works?
Yeah, see, nutrition is oftentimes neglected. When you talk about mental health, well, nutrition, that doesn't have anything to do with it. That's what many people think. But we have learned, and research has shown that there's a lot of nutrients that if they're not there, the deficiency of some of these nutrients can impact our brain and mental health.
Absolutely. We find that certain vitamin deficiencies affect directly the nerve function. I'm just thinking very momentarily on something like vitamin B12, that before the actual manifestation of the deficiency, there are already changes in the electroencephalogram, and I'm excited to hear what nutritional things can do as far as our thinking, our emotional, our intelligence quotient, how that can be affected.
That's true. Other things like sugar and fat in the brain, protein in the brain, does that impact our brain?
Now you're going into from preaching to meddling now. Sugar and fat, isn't that very important in the society today?
Our society lives and breathes those things, doesn't it?
Absolutely, and I think it's partly also related to the amount of stress and the way we struggle to deal with stress.
So true. Oftentimes people choose their food based on their stress level. Oh, I need some sugar. I need some chocolate. How about some ice cream? That would make me feel better.
Well, as we've heard already, that the changes in the blood sugar and the insulin, sometimes you feel a whole lot worse. But anyway, we've got lots to hear tonight.
Yes, Dr. Nedley is with us again, and we have had a wonderful 2 sessions with him. So tonight we want to welcome back Dr. Neil Nedley.
Thank you very much. It is good to be with you all again. And this is an important topic on nutrition in the brain. It's probably one area that is profoundly missed in society and even in medical offices around the nation. Often there's a disconnect between what we put into our body and actually how we think. But in reality, what we are putting into our body does have a profound influence in regards to how we're thinking. It can have a profound influence on our mood. It can even have a profound influence on our IQ and on our EQ. And so this will be a information-packed session. But I should mention that it's not going to be a comprehensive session. If we were going to do a comprehensive session on nutrition in the brain, it would take longer than 1 hour to do so. It would probably be a university course in studying it all. But I'm going to be centering in on some of the major influences that we have in our society and some of the major issues that I see in a day-to-day practice, particularly in dealing with the brain. We do have a treatment-resistant program for major depression and anxiety that we now conduct at Weimar, California. And in that program, whoever enters in, we do a series of tests to see what categories are present that can be reversed that could help their brain function. Now, there are over 100 causes of depression and anxiety. Fortunately, they can be categorized in 10 different ways, but the brain is pretty resilient, meaning that you can have one cause or 2 causes on board and still not suffer from depression or anxiety. You can even have 3 and get by with it. But once you have 4 separate categories of causes, the brain does start to go down. The EQ starts to go down. And the mood can just, you can actually fly off the handle and become much more irritable. In crying spells, feelings of emptiness can occur. And so when we talk about nutrition, some people may not have 4 hits. They might only have the nutrition hit, and they're eating poorly, and they seem to be getting by quite well. But there may be another individual that has 3 hits, and then when you add a nutrition hit into it, it makes a significant difference. And so this is why some people get confused, thinking that nutrition is not an important factor. It is an important factor, and what I have found is in many cases, even those that don't necessarily on our series of tests are so indicated as having a nutrition hit, we find out by altering what they're eating, they too can improve, even though they might be mentally healthy. And so there's advantages for all of us in regards to good nutrition. But our screening test takes a look at what we call nutrition hits. These are blows to the brain, so to speak. And as mentioned, is possibly the most overlooked cause of diminished mental power. Once a nutrition change is adopted, normally it takes 7 to 10 days to begin to notice a difference as far as the brain is concerned. Now, there are some, as you will find out near the end of this presentation, that only 3 days, and you can have a significant difference in brain performance. But in most cases, it's going to take 7 to 10 days, and that shouldn't be surprising. Medication for depression or anxiety takes at least 7 to 10 days. Some of them take several months to really start to work. And so in reality, nutritional changes will actually work quicker in most cases than medication. But then gradual improvement will continue, and it will peak somewhere 3 to 6 months after changing your diet. So the fortunate thing is, even though you're going to feel better at week 1 and week 2, you're going to think better, you'll continue to think better for up to 6 months. So clues of a nutrition hit: if your dietary inventory indicates a lot of junk food and or meat, that certainly is a clue. And what happens, particularly when people have mental health issues, particularly depression, there is a strong temptation to self-medicate. And what do most people self-medicate with? What particular foods in general? The sugar foods, yes. You can actually, a very good screening test for depression in your community is watch the cans of soda pop leave your local grocery store. And the volume of soda pop often is related to the rates of depression in that particular household. It turns out sugar does actually not only taste good, it actually transiently raises serotonin. And so you actually feel less depressed for a while. Unfortunately, there's a nadir that follows. In other words, a drop in serotonin lower than it was before we ate the sugary substance. But normally that takes place at a longer period of time, and so many people are not aware of that. So we look also for signs of a carbohydrate addict. And you mentioned it, there's one food in particular that 40%, according to the American Addiction Association, 40% of females in our population have an addictive relationship to this food. Anyone want to guess what it is? It is chocolate. Men can have that addiction too, but it's only 10% in men. There's often gender differences depending upon the addiction. And of course, not only will chocolate improve serotonin levels, it actually transiently does improve dopamine levels as well. And so that can almost have an added effect in regards to helping the individual feel like they are self-medicating. Low serum B12 or folate levels can be a clue of a nutrition hit. So sometimes we'll do a blood test, but often no obvious clues are present. Well, let's take a look at some of the primary nutrition hits that we might see in everyday society in America and also in many places throughout the world. One of those nutrition hits is insufficient dietary tryptophan. Tryptophan, it turns out, is converted to serotonin in the brain. First, we have to get the tryptophan into our diet. Then we have to get it into the brain. And once it's in the brain, it is converted to serotonin, particularly when there's bright light around. So that's an additional factor of sunlight or bright light. In the evening, particularly under darkness, that serotonin is then converted to melatonin, which, as we learned last night, helps your capacity to learn, retain, and apply knowledge. And it also helps you to have a rejuvenating sleep at night. In addition, it's also converted to niacin, or vitamin B3. One of the reasons why I'm highlighting it tonight is because it's the least abundant amino acid in the diet. There are 8 essential amino acids that we all need to build our proteins and our enzymes. And the least abundant of those is tryptophan. The conversion of tryptophan to 5-hydroxytryptophan, which is serotonin, is inhibited by several things. If you're not coping adequately with stress, you will make less serotonin. If you have insulin resistance, what's the disease process that we often call insulin resistance? We call diabetes, or now there's a pre-diabetes condition called metabolic syndrome. That also will reduce the rate of conversion to serotonin. If you have a magnesium or vitamin B6 deficiency, that can do it, or lack of light. And the older you get, you also tend to convert less. However, if it's just age by itself, you'll still be able to convert a lot if you don't have those other factors on board. In other words, if you're coping adequately with stress and you don't have insulin resistance and you don't have deficiencies in those areas and you're getting enough light, you can make as much serotonin at the age of 80 as what a typical New Yorker might make at the age of 25. And so it is important even for the elderly. Now, tryptophan has been shown in controlled studies to improve premenstrual dysphoria from ovulation mid-cycle to the 3rd day of menstruation. This is particularly important in regards to a very common condition that we call PMDD, premenstrual dysphoric disorder. About mid-cycle, some women, in response to making the progesterone, will have a marked decline in their mood. And that decline can last until the 3rd day of their menstrual cycle. There are some simple therapies for that. Light in combination with 5-hydroxytryptophan will often take care of the condition. Depression and seasonal affective disorder are both improved with tryptophan supplementation. Insomnia is also improved. And so if there's a sleep issue, getting enough tryptophan can help us get enough melatonin, and that can help with the insomnia. Obstructive sleep apnea has also been shown to be improved with tryptophan. And also withdrawal from at least one drug, nicotine. Studies show that if you're a smoker and you're wanting to withdraw from it, you would do better to make more serotonin. Makes sense, doesn't it? And so I'm sure that's true with other drugs as well, although they haven't been studied yet. Well, what are the foods that are rich in tryptophan? Here's some of them. I list whole milk at the top first because when I was in medical school, I was told that milk was a great source of tryptophan, and you can see it's not a bad source, 46 milligrams per 100 grams. But there are better sources. Black-eyed peas, walnuts, almonds, sesame seeds, gluten, sometimes called wheat meat, roasted pumpkin seeds, and also at the top of the list is concentrated soy, or what we call tofu, one of the Asian advantages in regards to mental health. Now, we could have mentioned some foods that are also pretty high in tryptophan, but one of the reasons why they're not mentioned here is because it turns out the tryptophan from particularly turkey, which is fairly high in tryptophan, can get into your muscle, but it does not get into your brain very well. And it has to do with the mechanism of tryptophan getting into the brain. In order for it to cross the blood-brain barrier, it's an insulin-mediated mechanism. In other words, it's good to have carbs on board as well, because then we will get the insulin response and we will get more tryptophan into the brain. Meat is high in protein, high in fat. It's deficient in carbohydrate in general. And so meat is not actually a very good way of getting tryptophan into the brain. There's another issue that revolves around getting tryptophan into the brain, and that is having less of the competitors You remember the competitors are in much more abundant supply. Tryptophan is the least abundant one. And so we want to have less of the 5 competitors of amino acids. So remembering those 2 points, I'd like to see how you do in regards to a question I'm going to ask you here. This is taking a look at the ratio of tryptophan to 5 amino acids. And at the top of the list, we see there are 2 that have identical ratios: whole milk and salmon. Now, which of those foods will actually get more tryptophan into the brain? All right, some say milk and some say salmon. Now, salmon has some good characteristics that we're going to talk about later on, but I'm talking about tryptophan. Which one will help get more tryptophan? All right, I'm hearing more milk, and that's correct. Why will you get more tryptophan from milk? Because you have carbs in milk. You don't have carbs in salmon. High in protein, high in fat, carbohydrate deficient food. Now let's see how you do on the next 3. The next 3 also have the same ratios: beef, chicken, and brown rice. Which one will you get more tryptophan into the brain? All right, you're with me now. Black-eyed peas, a little bit higher yet. Soybeans, a little higher yet. Walnuts, higher yet. Pumpkin seeds, higher yet. Tofu, even though it's a great source of tryptophan, is only number 3 on the list in regards to the ratio. There are 2 foods that are higher in the ratio, and that is almonds, number 2, and number 1, a great ratio, is sesame seeds. One of the advantages of hummus or tahini, sesame seed butter, etc. You will definitely get more tryptophan into the brain. Interestingly, studies by Dr. Marcus and others took a look at stress-prone subjects. In stress-prone subjects, high carbohydrate, low protein food prevents a deterioration of mood and performance under uncontrollable laboratory stress conditions. So even though tryptophan comes from protein foods, when we lower the protein in general, we actually get more tryptophan into the brain. And that's because of less of the competition. Stress-prone subjects have a higher risk of brain serotonin deficiency. In such subjects, higher natural carbohydrates, notice that 3-word phrase, higher natural carbohydrates do what? Increase personal control. An interesting a subject when it comes to emotional health under stress. Carbohydrates, it turns out, prevent a functional shortage of central serotonin during acute stress due to their potentiating effect on brain tryptophan. And there's good, even though this was a more bench research, there's very good clinical evidence in the last few years that is a much better way to go in regards to mental health. Higher natural carbs, lower protein in general from what most Americans are consuming. Now there's another amino acid. It's more abundant than tryptophan, but it's very important because it gets mental health connections in many ways. Tyrosine is incorporated into proteins of all life forms and is a precursor for synthesis of thyroxine, which is your thyroid, melanin, which has to do with skin pigmentation, and kephalins, which have to do with some brain chemistry there as well, and the neurotransmitters dopamine and norepinephrine. Those neurotransmitters, by the way, we've already mentioned 3 that the drug companies are all attempting to manipulate by utilizing antidepressant drugs. Serotonin is one, and dopamine and norepinephrine are the other. And it turns out tyrosine gets turned into both of those. Tyrosine is also a potent antioxidant and also stimulates growth hormone production, so it can be helpful in even building the body up or building muscle. It may be of therapeutic benefit in improving depression, hypertension, stress, cognitive function, even memory, Parkinson's disease, PKU, and also narcolepsy. Narcolepsy is that condition that you have that when you sit down, you want to fall asleep. And sometimes it can get so severe that if you're at a long stoplight, you will be nodding off. It can be kind of a dangerous situation. But tyrosine has been shown to significantly benefit even a narcolepsy. Tyrosine supplementation in response to stress has been studied. Those given tyrosine had significantly reduced headache, stress, fatigue, muscle aches, and sleepiness compared to controls. And improvements were noted in mood and mental states. They looked at happiness, mental clarity, hostility, and tension. All of those were improved. Cognitive tests, such as math skills, coping map compass, and pattern recognition, were also improved in the tyrosine group. So it's improving both EQ and IQ. Now, tyrosine has also been shown to result in feelings of vigor and improvements in blood pressure. It actually lowers blood pressure in those with high blood pressure. Well, this is the tyrosine content of foods, a little different than the tryptophan content. You see mustard greens, not a bad source. Lamb's quarters, by the way, that's not the hind leg of a small sheep. Lamb's quarters is actually a green. Tomatoes, tofu, edamame called green soybeans. This is where eggs line up. Almonds, oats, sunflower seeds, peanuts are near the top of the list, but even higher than peanuts are pumpkin and squash seeds. Now, tyrosine, it turns out, Dr. Marcus also studied tyrosine, and he found an identical effect that when we lower the protein intake in general, we get more tyrosine into the brain. And so, again, you don't want to be on a high-protein diet to get that tyrosine into the brain. There are also several competitors for tyrosine as well. And those several competitors are, you can see the foods that are better in it. The bottom would not be so good, and at the top would be very good. But sweet potatoes, flax seeds, chia, beef, tofu, pumpkin seeds, soybeans, spirulina is near the top, watermelon also near the top, and mustard greens actually top out the list as far as getting tyrosine into the brain. One of the things I've noticed is if you are a caffeine-free individual, which as you noted we recommended due to frontal lobe function a couple of nights ago. But if you're caffeine-free and you eat watermelon, you need to watch out. Don't eat it in the evening because it can rev you up to the point where you're not able to sleep very well. Watermelon is a much better vigor food. Since tyrosine is that vigorous amino acid, you do much better with watermelon as a breakfast food or even as a lunch food, but watch out as an evening food because it will cause some stimulation. Fortunately, it's not a stimulation like caffeine where it's going to down-regulate other things. And so you just get the benefits without the risks of it. The ironic conclusion that was made by Dr. Marcus and others is don't chow down on high-protein sources to boost either tyrosine or tryptophan. Emphasize carbohydrate-rich plant sources of nutrition. An additional cause that's actually been listed as a cause for depression is not enough folate in the diet. Folate is sometimes called vitamin B9, and it is something that our U.S. government has targeted as being undersupplied in many Americans' average diet. They recommend 400 micrograms a day and state that many Americans are not getting that. But actually, as far as mental health is concerned, you would be better to get 1,000 micrograms a day. It turns out folate is utilized in the pathway to produce all three neurotransmitters that we've been emphasizing: serotonin, norepinephrine, and dopamine. And these are the sources of folate. As you notice, if you're getting it from steak, 16 micrograms, that's a double serving of steak. You'd have to eat a huge amount to get enough folate, probably enough that it might kill you right at that meal. A half cup of parsnips, 44 micrograms. Pineapple juice, 58 micrograms. Fresh orange juice, 75 micrograms. Spanish peanuts, 88 micrograms. Mustard greens, 105. So your greens are going to be higher in it. Notice spinach, 109. Navy beans, now your legumes are going to be higher yet, 255 micrograms. Okra, you don't know about okra in New York, do you? Okay, you do know about okra. Very good. It's known as a southern delicacy in Oklahoma. But notice lentils. I know you know about lentils, being from the Northeast. I know the people up in Boston know a lot about them as well. Notice 1 cup, 831 micrograms. But the highest source, black-eyed peas. Just one serving of black-eyed peas, over 1,000 micrograms of folate. And it can make a significant difference. You know, often drug companies will try to actually patent some of the nutrients in plant foods because they know their positive effect. And one of the drug companies has come out with a drug. What they did is they took folate and then added a methyl to it. Very expensive antidepressant drug called Deplin, but really it's just folate. It's a very safe drug. You know, you don't have to list all of that huge side effect list on the typical drugs. But in reality, most individuals would do well just eating enough plant-based foods and wouldn't necessarily have the need for that medicine. Now, there might be cases where you have an enzyme deficiency where you might need huge doses and you might need a medicine called Deplin. But for the most part, it's just changing the diet that will produce this dramatic effect. Now, there's another issue in regards to depression and anxiety and also mental health in general, and that is if we begin to form atherosclerosis. Atherosclerosis can cause heart disease. It can cause also mini strokes in the brain. We can see evidence of this in people that don't even appear to have a stroke, but when we do an MRI, we see some of these white matter defects, these little stroke areas, and that can cause some middle-age cognitive decline and other types of issues as well. But even before that happens, high cholesterol has been shown to not be very good for the brain if you have it in your bloodstream. Patients with major depression tend to have significantly higher cholesterol levels than healthy adults. In addition, those with depression with high cholesterol levels actually have a much less likely chance of responding to medication. In other words, they are treatment resistant. And this clicker may have become battery resistant right now because it's not going forward. Maybe somebody can help me there in the back and move me off of this. And if we have anyone that has a battery replenisher, that would be helpful as well. That bullet point just stated the same thing that I mentioned there, but if you could go ahead to the next one. Lowering cholesterol levels have been shown to improve depression and mood and also improve what? Impulsivity. Now, this is something that has been the enigma of the pharmaceutical industry when it gets to depression. The most commonly prescribed antidepressants actually take some time to improve depression, and before that time elapses, they have a side effect that's very common called worsened impulsivity. As a result of that, they have a black box warning that states that if you're going to use this in depression, you could increase the risk of what? Suicide. And how do you balance that risk? It's really tough to try to balance that risk. Now, as a physician, I'm not saying I prescribe antidepressant medicines. There are certain individuals that we need to actually jumpstart them for a while before their lifestyle changes, and these antidepressant medicines can actually improve frontal lobe function in those with significantly declining frontal lobe function. But it's far better to utilize a therapy that's not only going to improve the depression, but actually improve the impulsivity as well. And it turns out having enough, or actually having that cholesterol lowered will significantly help. Now let's take a look at some of the cholesterol in foods. Notice fruits, grains, nuts, and vegetables. How much cholesterol? If you want to know if something has cholesterol in it, just see if it has plant foods. If it's only plant foods, it has no cholesterol. If it's going to be animal foods, you're going to see cholesterol there. Notice even skim milk has cholesterol in it, about 4 to 5 milligrams. 2% milk, 18 milligrams. Whole milk, 33 milligrams. The egg white is the only exception to the rule. Egg whites do not have cholesterol in them. Mayonnaise, 8 milligrams. Ice cream, 29 milligrams. Butter, 31 milligrams. And this is where the world often gets confused. Well, this wasn't the one I was going to highlight, but this is certainly confusing. Many individuals think eggs are part of a healthy heart program, But there's actually, particularly if you're going to want to lower your cholesterol, you really need to, if you're going to eat eggs, throw out the egg yolk and just eat the egg white. 213 milligrams. It is loaded with cholesterol, but this is where the world is confused. Many think that tuna is part of the plant kingdom and has no cholesterol. Tuna is part of the animal kingdom. It has a liver. It makes cholesterol. And studies show that if you put a healthy vegetarian on fish, their cholesterol levels invariably go up. Clams, 57. Crabs, 64. And then this is also confusing to many individuals. Notice if you scrape the fat and the skin off the chicken, 73 milligrams of cholesterol. Pork, 76. Beef, 80. And if you don't scrape the fat and the skin off, 82 milligrams. There's really not much difference there between the so-called white meat and red meat as far as cholesterol content is concerned. And then this also confuses many. Oyster, 84 milligrams. You know, the seafood can be quite loaded. Sardines, 120. Shrimp, 165 milligrams. And then when you get to the organ meats, it's very high. Kidney, 329. Liver, 410. Caviar, 500 milligrams per 3-ounce serving. And if you see anyone feasting on beef brains, you have to wonder about their intentions. Because one 3-ounce serving, 1,697 milligrams of cholesterol. Now, cholesterol is not important because it will raise your blood cholesterol. It's also important in regards to how we're getting that cholesterol into our bodies. Dr. Bruce Taylor, not too far away from here in New York, at the medical school in Long Island, did a study a few years ago. It was actually a fortuitous study as medical students came to him and said, we want to feed pure cholesterol to rabbits and monkeys, just to see what would happen. They wanted to publish some results. And so he said, well, why are you coming to me? And they said, well, you're the cholesterol researcher. We thought you might have some. And he says, well, I do. I've got a lot of cholesterol. It's over there in the corner. It's been there for a while, but it's pure cholesterol. You can go ahead and use that. And so they fed that pure cholesterol to rabbits and monkeys, and within a few weeks, all of them began to have strokes, heart attacks, major damage to their arteries. They came back to him and said, we knew cholesterol was bad, but we didn't know it was that bad. And he says, you know, I didn't think it was that bad either. And he started thinking about the cholesterol that he had over there in the corner. The lid had been off. It had been exposed to the air. It had become discolored. And so he decided, as a follow-up, now he's in charge of the studies, to feed pure cholesterol that had never been exposed to the air to rabbits and monkeys. None of them developed any vascular damage whatsoever. It's the oxidized cholesterol that produces the vascular damage. And then he went to the next step and actually began to feed foods to monkeys. And it doesn't take long for the damage to be done. 24 hours later, he was examining their aorta for the damage, the dead cells that were occurring there in the intima. Anyone want to guess what the most harmful cholesterol is to monkey aortas, at least? Number one, custards. Now, what's custards? That's when you take eggs, milk, and sugar. If you mix up cholesterol in a sugar environment, you are going to much more heavily oxidize it. And the most commonly consumed custard in America? Good old-fashioned ice cream. You've got it. And fortunately, there are now ice creams available that don't have cholesterol, that we don't have to worry about oxidized cholesterol. There's Tough-Fruities and Ice Dreams and Rice Dreams, etc. And a good friend of mine actually became a good friend after he actually fed me his 32 flavors of ice cream. One more than Baskin-Robbins. No cholesterol in it whatsoever. It's just hitting the markets now. It is, in fact, he was wondering at the time he was feeding it to me what he could call it, because the U.S. government would not allow him to call it ice cream because it has to have dairy in it if there is ice cream. And so what he called it is, we can't say it's ice cream. It actually is better ice cream than I've had, including the dairy ice cream. It's very tasty, and it's not soy-based or rice-based. It's actually oat-based, and very tasty. Number 2, pancake mix was the second most damaging. And what's pancake mix primarily? It's powdering up eggs. And then third most damaging was Parmesan cheese. It was actually powdered cheese, of course, tied with lard. That's not a misprint. Lard was number 3 on the list. So it's not only the cholesterol, but how we're getting the cholesterol in our diet. And this explained a couple of other studies that had been done in vascular research earlier. Jeremiah Stamler in the Western Electric study showed that your dietary cholesterol is an independent risk factor for atherosclerosis, regardless of what your serum cholesterol is. Now, serum cholesterol is still a risk factor, but an additional risk factor is dietary cholesterol. And then in the heart study of in Louisiana by Dr. Berenson, he actually showed that some infants, the way their mothers, I should mention this, the way many American mothers eat, the amount of cholesterol in their human breast milk is higher than it is in cow's milk. Which infants do you be, and what he demonstrated is infants actually begin to get the fatty streaks of atherosclerosis, some of them. Which group do you think had the fatty streaks? Those consuming human breast milk or those consuming cow's milk? Well, I mentioned breast milk can have higher cholesterol levels, but in reality, those consuming human breast milk clean blood vessels. Why is that the case? How do most infants consume human breast milk? They get it directly from the nipple, it's not exposed to the air, and it's not oxidized. So the best way for you to drink your cow's milk would be to go down to the barn and get it straight. Anxiety has also been studied in regards to diet, and this was a study done not too long ago. General anxiety disease patients and depression had significantly lower blood levels of antioxidants in comparison to healthy controls. After dietary supplementation of these vitamins for a period of 6 weeks, a significant reduction in anxiety and depression scores of patients was observed, and you can see the statistical factor for those into statistics. It makes a significant difference. And so we do want to make sure that we have antioxidants. And the power of whole plant foods is healthy to the brain. Actually, the power of whole plant foods exceeds that of their component parts. 1 cup of kale, for instance, has 50 milligrams of vitamin C and 13 units of vitamin E. But the antioxidant potential of 1 cup of kale is equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. And so at the University of Maryland, the Food and Nutrition Center in Baltimore took a look at the top 10 antioxidant fruits. Number 10, hopefully this is going to work for me, it is. Number 10, grapefruit. Number 9, kiwi. Number 8, cherries. Number 7, red grapes. We continue to extol the virtues of red grapes. Oranges were actually number 6. This is a humble fruit, but it's very potent antioxidant fruit. Plums. Raspberries, number 4. Number 3, strawberries. Anyone want to guess what's in the top 2? Blackberries, actually, are number 2, even above strawberries. And I think we have an educated audience here tonight. Blueberries, number 1. It also took a look at the top 10 antioxidant vegetables. Number 10, eggplant. Number 9, corn. Number 8, onion. Number 7, red bell pepper. Number 6, beets. Number 5, broccoli. Number 4, Brussels sprouts. Anyone want to guess what's in the top 3? All right, we mentioned kale earlier. Spinach is actually number 3. Kale is number 2. And it's not cabbage is number 1. Not cauliflower. All right, you'll kick yourself for not getting this. Number 1 is garlic. One of the advantages of being married to a Romanian like I am is every entree seems to start out with 4 cloves of garlic. Many of you have heard of the lifestyle heart trial by Dr. Dean Ornish, done many years ago. In fact, that's a heart trial that's being unveiled now. Even Medicare is paying for patients to get on this heart program if they have a significant heart disease. But when he unveiled this program, I noticed that he looked at anxiety, depression, insomnia, and anhedonia. Anhedonia is the inability to experience pleasure. And he did this study. And as part of his plan, what he was serving was a vegetarian diet to see if diet alone could reverse it, along with exercise and stress reduction. And he found out it did. And it, of course, a lot of national press. I asked him, why did you study mental health? Because it really, in my opinion, although it was a good diet, it wasn't necessarily the optimal mental health component. They weren't looking at tryptophan levels, they weren't looking at thyroid, they weren't looking at omega-3 levels. So I think they probably could have designed it better that way. But he said the Ethics Review Board at the University of California, San Francisco, made us study it. And I said, what were their thoughts? He said, well, their thoughts were that if we were going to randomize them to the plant-based diet, that many of them would have to change their restaurants. They might even have to change their social affiliations. The food might taste worse. And even though it might improve their heart disease and their atherosclerosis, it might actually make them mentally worse. And so you must study this. And so when they did the randomized trial, they did study it out. And they found out the combined score at baseline, on average, was 27.2 for those who were randomized to the vegetarian diet. And 1 year later, actually, the scores significantly improved. And so, despite the fact that they had to change restaurants and it might have affected social affiliations, it actually significantly improved their mental health. When they took a look at the American Heart Association diet, which was the control group, it was exactly the same. And so that study really pioneered other studies that have followed that have showed a plant-based diet does have significant superiorities. And one of the examples that was used in recent history is the California prison study. Now, on our board, I mentioned we run depression recovery programs at Weimar, but part of who used to be on the Weimar board is a businessman in Bakersfield. His name is Terry Moreland. And he was aware of some of this research, and so when the prisoners were coming in to be housed in the prison, he would have a nutritionist interview the prisoners. And that nutritionist would then explain the benefits of a plant-based diet to the prisoner, and the prisoner could choose either to be on a plant-based diet or a typical American diet. Now, when they had to make that choice, some of the prisoners thought it was punishment enough to be in prison, but it would be cruel and unusual punishment to be on a vegetarian diet, and so they chose the typical American diet. Other prisoners chose the vegetarian diet. What percent do you think chose the vegetarian diet? Actually, over 90% chose the plant-based diet, which means it was a good nutritionist that was explaining the information. And the prisoners, looked at it this way, many of them. They said, I'm here by myself. I'm here alone. This is something that might help me. What's it going to hurt for me to try? And they went ahead and tried it. And what happened was pretty amazing. These prisoners would talk about, of course, there's stressful things that happened on both sides of the prison. But when these stressful things would happen, instead of wanting to lash out and lose their temper, they noticed they had control. And when this occurred repeatedly, their comments would be, I think if I were eating like this on the outside, I probably never would have ended up in here. Now, what Terry Moreland was able to do as a result of this, of course, he's a businessman, what do you think he was able to do? He was able to save money on expenses on the end of the section of the prison where the prisoners had higher emotional intelligence and more personal control. And I'm not sure exactly how it happened, but the California state also takes a look at income tax returns, et cetera. And so they were seeing some profits being made in the prisons, and a few years ago they canceled his contract. And the first thing they did when they canceled the contracts was cancel the dietary component of the contract. What do you think has happened to their running of prisons in California? It has significantly gone up. In fact, one of the reasons it's always mentioned in the California debt crisis is their poor running of prisons. Fortunately, last year they asked him to run them again, but he doesn't trust them since they're now virtually bankrupt, and he's got other business things that he's doing, so he actually turned it down. But the other thing that came out of it is, in our country, we have a high recidivism rate. Many prisoners come back to prison. Those that were on his plant-based diet, and I should say, Norway is the best country as far as recidivism rate. I think it's somewhere around 15% that is that recidivism rate. Some prisons in some states, it's over 50% in our country. But those that were on that plant-based program, only 4% recidivism rate. And so a significant difference emerged there as well. And then there are other personal examples, some of them very famous examples. And I'm just going to show you this short video clip of a famous individual. I should mention who this famous individual is before we go to it, because some of you are from other countries. But this was thought of to be the best boxer in America for many years, and some have even thought that he was the best boxer ever. And he was recently interviewed on Fox News, if we can see that interview at this time.
How long have you been a vegan?
2 years.
And notice any difference?
No, sometimes, every now and then, because sometimes I forget to eat sometimes.
Yeah.
But every now and then I get little aches, but I feel awesome.
Because you're vegan. That's what people say who are vegan.
Awesome.
Say that they lose that they don't have arthritis problems.
I feel awesome. Feel awesome.
Mentally, feeling different with the vegan?
Incredible. Incredible. There's no way. I think I wish I was born this way. I wish, but I just can't. Just when you find out about the process for stuff you've been eating, and I wonder why I was crazy all those years.
The food.
Yeah, I can imagine. Wonder why I was crazy all those years. All that garbage I was eating, running around. Drugs didn't help either, but all that stuff.
Yeah, I was gonna say the drugs didn't help either.
Oh.
But so who does the cooking? The vegan cooking?
My wife does everything.
Did she get you to be a vegan, or you get her to be a vegan?
No, she's not a vegan. My wife would never be a vegan. My
No?
wife is the woman. She goes on these. All right, this week we're going to be a vegetarian, guys. This month we're going to be vegan, guys. What suits her? She wants to lose some weight. She's a vegan that month. She wants to, vegetarian. But she likes to eat fish and food and everything, red meat and stuff. But she's the one that inspired me to become a vegan. Because she was a vegan that particular month, I guess.
And you'd stuck with you.
Yeah, I stayed with her. She just continued living her life.
How about fighting? Boxing?
about
Is that any chance we're going to see you?
I could play, me fight somebody? No, somebody would kill me. I just don't have that attitude no more where I want to stare a guy down and talk about killing his kids and his mother. It's just not.
It's over.
Yeah.
So if it can do that for Mike Tyson, what might it do for you? Well, obviously, I should also mention, just to balance things out, that we don't, in our program, of course, our 10-day treatment-resistant program, we're in control of the diet. So they're on a plant-based diet. We want to get the very best results. And we also want to see that modeled. But depending on the hit list, not everyone necessarily needs to stay on that plant-based diet in order to experience the benefit. Some will. It's not just the Mike Tysons of the world. There's an airline pilot who lost his ability to fly an airplane due to actually significant depression that developed. And he actually pulled himself out, was failing his practical tests, particularly under very stressful situations. And he recognized he had depression. And he had been through other programs, but he did hear about our program and came to our program and experienced a transformation in that program. And with the things that he has in his background, he's noticed that he has to stay on a plant-based diet. He's gotten off of it several times, and it starts to really come back, and it starts to make a difference. He is out there talking about the significant benefits of the diet for him. And so this is why, again, it depends on your constellation as to how important that is. But in general, it's a good, healthy diet for most of us. Iron deficiency anemia is common, particularly in women, and is associated with apathy, depression, and rapid fatigue when exercising. It's essential for good athletic performance, scholastic performance, and cognitive function. Iron-dependent neurotransmitters include dopamine, serotonin, norepinephrine, and another one called GABA. GABA is GABA-aminobutyric acid. It's what helps us to stay nice and calm under stressful situations. Now, it's important to look at the iron content of foods. Avocado, 2 milligrams per avocado. Steak and ground beef, 2 milligrams. Mangoes, 2 milligrams. Green peas, 2.4. And lima beans, 4.5. I should mention that heme iron is absorbed twice as readily as non-heme iron. So the meat products will be absorbed. Studies are showing that the heme iron, you don't have any choice but to absorb it. The non-heme iron, if you have an iron excess, your body will down-regulate its absorption. Too much iron is actually a protooxidant. It can actually cause some genetic damage, possibly vascular damage, etc. So you want enough iron, but not too much iron. And the plant-based irons help you to prevent getting that too much iron if you already have too much iron. But many women are lacking in it, particularly in their reproductive years. Whole wheat flour, 4.6. Whole wheat is a great source of iron, but when you eat white bread, it says it's been enriched, and it turns out only 20% of the iron is returned in enriched white flour. I don't know about you, but if someone took $100 away from me and gave me $20 back, I would not say I had been enriched. But nonetheless, that's what the labels say. Kidney beans, 5.2. Almonds, 5.2 as well. Spinach is actually a good source of iron. Cashews, pistachios, soybeans are a good source. Sunflower seeds, toasted wheat germ, tofu, amaranth grain, and rice bran are also important. Resveratrol is important in general for the brain. It may improve the blood flow to the brain by up to 30%. Studies are showing it can help protect the brain from dementia. It's primarily in grapeseed extract, and it's been shown to protect against toxicity against beta-aloid amaprotein. And it's not just grapes that have it. Bilberries, cranberries, blueberries are a good source. Peanuts are actually an excellent source, as well as the red grapes, ligonberries, and particularly the Merlot red grapes. In addition, another cause of lack of mental power that needs to be mentioned before we round things out tonight is low omega-3 fatty acid intake. Omega-3 is an essential fat. We all need it in our diet, and many Americans are not getting enough omega-3. Improved frontal lobe function occurs with it, improved sense of well-being, increased vigor and energy, improved reaction time, improved attention, improved test scores, improved mood, better control of thoughts and behavior, and less impulsivity. That's in healthy people. Now, in mentally unhealthy people, it's shown to decrease risk of at-risk young people becoming psychotic, helps prevent major depression and anxiety in women with psychological distress, decreases anger in men with aggressive behaviors and problems with the law, and a clinical response rate of over 50% in those with major depression or anxiety just by adding enough omega-3 to their diet. And so that is almost equivalent with many medicines that are out there. It's been shown to also improve bipolar disorder as well. It's been shown to improve memory in those with middle age-related cognitive decline if that comes from plant-based sources. It improves aggression and depression in those with borderline personality disorder, lowers the risk of dementia, and it can improve some aspects of ADHD. And if you're breastfeeding your child, they'll get more omega-3, about a 5-point higher IQ rise as a result. Most of the formulas out there don't have omega-3. Well, how do most people get their omega-3? How most Americans get it is through fish. These are the top 10 fish in it. And there's something that actually I learned as a result of coming to New York City and presenting this list. I was speaking to a Jewish audience some years ago, and they mentioned the top 10 fish in omega-3 all have one characteristic. They all have fins and scales. And so that's what we would call the clean fish, one of the advantages there. Not all fish are high in omega-3, but fish 100 years ago was a great way to get your omega-3. Today, it's a problem because of what we call biomagnification. This study in Clear Lake, California showed that if you eat herbivorous fish, that means a vegetarian fish, it's better, but it's still pretty high, 40 to 300 parts per million of DDD, and carnivorous fish have up to 2,500 parts per million of DDD. And the EPA is now recommending you eat less fish, simply because of the mercury levels that are out there. In fact, all fish have levels of mercury now, whether it's fish farmed or even about the Alaskan Aleutian waters. And it has gotten into the rain and water supply, and it gets concentrated in the fat of fish 1,000 to 1,000,000-fold of what it is in the water. And mercury has been shown to cause insomnia, nervousness, hallucinations, memory loss, headache, anxiety, irritability, daytime drowsiness, emotional instability, depression, and poor cognitive function. Almost the opposite list of what omega-3 does. And so the idea, of course, is to get sufficient omega-3 without cholesterol, mercury, or other toxins. And so I recommend the plant-based sources. Almonds, spinach, green soybeans are a high source, mature soybeans are not, soybean oil, whole wheat, wheat germ oil, black walnuts, English walnuts, chia seeds are near the top of the list, and also flaxseed or linseed oil. There are recent studies done by Arizona State University, Dr. Beeshold and Johnston, that have put people on a prospective diet where they're on a fish vegetarian, or they're a plant-based vegetarian with possibly a little dairy, no eggs in that study, and then also a regular, typical American diet. And they find after 14 days, significant difference in mood comes about in only the plant-based diet. The fish diet wasn't statistically significant with the other, and it may be due to this issue, and it may also be due to arachidonic acid. Arachidonic acid causes inflammation, and it's present in animal foods. It's not present appreciably in plant foods, and that may be another advantage. Well, I would encourage you to learn more about nutrition. We do have resources available in the Lost Art of Thinking and other places to learn a more comprehensive approach in nutrition in the brain. And I would like to actually close with Denis Diderot's proverb. He was a French philosopher a couple hundred years ago. And he stated this: doctors are always working to preserve our health, and cooks to destroy it. But he didn't end there. He said the latter are often the more successful. It doesn't have to be that way if we retrain the cooks. If we can retrain the cooks to have healthy food that is also tasty, there's no reason to go back the other way. And so I would encourage you to at least try 6 plant-based healthy dishes that you can learn. If you learn 6 entrees, you'll be eating the same amount of entrees as what the typical American eats in 1 month. And then after that, you can grow from there and continue to optimize your brain. Thank you very much.
Nutrition. I am sure you have questions about that. Wonderful information. Your nutrition, what you eat, transforms itself in chemicals in your brains. Wonderful. I'm sure that we have questions on the audience here. So if you have questions, raise your hand up high, and you will be directed here, and Dr. Nedley will be answering the questions that you have there. And I'm sure, Dr. Nedley, that even us here, we have some questions for you as well. And if you're on the website watching, just send us your question right there and choosefulllife.org, and we'll try to get to you, okay? And there's some hands. Just raise it high so that they can see you and bring you to ask those questions.
You know, I was fascinated and found that just having been at the American College of Cardiology last weekend, they are promoting the blueberries very, very significantly, obviously for the reasons that you've pointed out. So that's brain, cardiovascular. What is interesting to me is that as a young man, I was deeply impressed by an Olympic athlete who, in South Africa, found that before he went to the Olympics, for the 3 months of training, he would move off flesh foods. His performance was enhanced, and his thinking was enhanced, his strategies were enhanced, And that's one of the reasons that I chose to go onto a vegetarian diet at that stage. So we're seeing the scientific corroboration in a very important way. Would you comment on physical performance as well as mental performance?
Yes, our emphasis, of course, was mental performance,
Sure.
but there are a lot of physical advantages, particularly in regards to endurance. You know, one of the things that you kind of notice even in the animal kingdom, you know, elephants actually are vegetarian and they can run all night long, you know, 20 or 30 miles an hour, etc. Cheetahs are not vegetarians. They can have great bursts for about 80 seconds, but then they're done. And so, in general, the plant-based is the way to have the endurance.
And also the strategic planning, because of the brain functions
Absolutely. Yeah, if the sport is going to require frontal lobe function.
Exactly.
Particular, yeah.
Very good. We have a lot of people with questions, so we ask that you make your question short and one question per person. Okay, we have Dr. Sherman.
I'm Dr. Roby Sherman from Wildwood, Georgia. And Dr. Nedley, I'd like for you to please tell us in the audience what percentage of the DHA and EPA is converted from the flaxseed chia seeds that are highest in the omega-3s to the usual fish oil type DHA and EPA, because there's so much touted about this that you must have the fish oils.
All right. Now, hopefully the people in the back still have my slides up there, because that was going to be the next slide that I showed. If you can put it up as to where it was. If not, I'll just speak off the cuff. But not seeing it there, I'll just begin to speak off the cuff. It is very clear that ALA does get converted to EPA and DHA, but there has to be several things. And let me just go through this. Those are the different types of omega-3, ALA, EPA, and DHA. Each one of them is a longer chain. ALA is 18 carbons, EPA is 20 carbons, DHA is 22 carbons, and they all do some nice things for us in the body. ALA turns into EPA, which can turn into DHA, but it requires several things. Enough B3, which is niacin, enough B6, enough magnesium, enough zinc, and enough vitamin C. And if you have that on board, you convert more of it. There is some preliminary evidence showing that plant-based you convert more, but there's also very good evidence showing if you are plant-based, you don't need as much DHA in order to experience the mood and mental health benefits. And of course, you can get DHA and EPA from the plants of the waters. That's where the fish get it from. They have no ability to make EPA or DHA, so there are supplements out there that are plant-based EPA and DHA supplements if you need them, and sometimes we use them. DHA is more for focus and memory. EPA is more for mood stabilization. And so sometimes we might, in certain select cases, utilize that. But that's the short answer, even though it was longer than it should have been.
Thank you.
Dr. Nedley, they are talking about how great dark chocolate is. What do you think?
Okay, dark chocolate. Well, I think I alluded to that earlier. You know, the world is fascinated with things that have benefits as well as risks. You know, for instance, we talked about alcohol the first night. And alcohol does have some benefits. If you drink enough alcohol to get cirrhosis of the liver, you will only have a 20% chance of dying of heart disease compared to someone in the general population. Alcohol is a major contributor to cancer, even in moderation in regards to colorectal cancer, breast cancer, but yet we continue to hear the benefits cardiovascularly of alcohol. That's what will get the evening news, and the risk factors tend not to get the evening news. Dark chocolate, of course, I haven't met anyone yet who consumes just the beneficial aspect of the cocoa by itself. It's so bitter. There is some antioxidant properties that are obviously there, and they're being extolled. But the only way we can make it palatable is by pouring saturated fat in, which will increase our liver's production of cholesterol, and then sugar on top of that, which produces its set of risk factors. So I prefer to get my antioxidants another way without dumping saturated fat and sugar in it.
I think you have a good IQ, doctor. That makes sense, doesn't it?
And I think that exactly, I really appreciate the balance of saying the risk and the benefits. And the same thing comes with caffeine. You can open up journals on a weekly basis, and some will have the benefits and some will have the downsides. But we always like to play with the risk as humans.
That's right. Why not get our beans without the caffeine instead of using the coffee bean?
Exactly.
Hello, Dr. Nedley. My name is Dr. Green. I'm a young resident in internal medicine, and I had a question for you regarding tryptophan and tyrosine. You discussed how that helps with mood stabilization, and if someone does not actually have those problems, if they took those supplements, would it be a problem? In residency, it's very stressful, and you work many hours, long hours. So my question is, taking those things preemptively, can that be done?
Yeah, now I really want to emphasize the fact that we can get this through plant foods primarily as the best source. I'm not recommending that everyone come out of here and take 5-HTP supplements or tyrosine supplements. We might use them in select individual cases, but if you're fine and you're functioning as a resident, I wouldn't recommend supplements for you. But yes, it can produce some mental advantages of having those there. Having said that, one interesting study showed if you remove tryptophan from the diet entirely and you have no other risk factors for depression on board, you actually won't experience depression. You will make zero serotonin, but without the serotonin, you won't even have depression, which tells us depression is a multifactorial disease. And so that is an interesting tidbit, but yes, it's good for all of us.
Thank you. Yeah, wonderful for us to think about this issue with supplements, because people say, oh yeah, melatonin, you talked about melatonin the other day. I need to just go and get a lot of melatonin or any other of these wonderful nutrients that you talked about, but the supplementation may not necessarily be the best way to get it. The plant foods is the source.
Yeah.
So-
Hi, Doc. I noticed you haven't mentioned anything about coconut. Can you share any information on coconut?
Oh yes, the country is on a coconut oil craze. And what is happening, I'm seeing this in my clinical practice. Coconut oil is a saturated fat, it is a tropical oil, and it will increase your cholesterol levels, despite what you're hearing out there. Now, coconut in general is a pretty healthy food because coconut doesn't have much oil in it. So if you're eating the coconut and spreading that on something, that's fine. But if you're concentrating in an oil and eating it that way, Americans are not short in saturated fat. Saturated fat is not even essential fat. And in general, we have too much saturated fat, and adding another saturated fat on top of that, I'm seeing more problems than I am benefits from people consuming that coconut oil craze.
Okay, very good. Another question.
Hi, good evening, doctor. I'm on a plant-based diet, and I believe that they are very rich in nutrients as compared to a non-vegetarian diet. However, I have a question. Is there any research that shows that organic foods or organically grown fruits and vegetables are better than inorganically grown fruits and vegetables in regards to nutrients?
Okay, well, let me just mention this. If it's not organically grown, it still has significant benefit. In fact, recent research shows the highest pesticide levels we will find in human beings are those that consume animal products. And so a lot of people are scared away from eating groceries that are plant-based out of the grocery store. But in reality, those groceries have to have enough of certain nutrients, otherwise that plant food would not have come about. And so having said that, it's much better to eat commercially grown, non-organic fruits and vegetables than not to eat them at all. But there are some advantages, not as big as you might think, some advantages in eating the organic foods. There are a few more bioflavonoids, a few more nutrients packed in, but in general, the better the taste of the vegetable or fruit, the more nutrients it has. There's a reason why we have a sweet tooth. Studies show the sweeter that fruit or vegetable is, in general, the healthier it is for us. So if it is palatable in the mouth and it's from a plant-based source, it's a great food.
It's good to know. We have another question.
Hello, doctor. I'm a vegetarian, but unfortunately, I'm allergic to all nuts except cashews, peanuts, and almonds. And I was just wondering if there's anything that you can make it reversible, or what causes these allergies.
Well, nut allergies are fairly common, but fortunately, you can eat 3 that are healthy for you. And so I would emphasize, particularly almonds are being extolled in many places. You saw it on the omega-3 list, the tryptophan list, the other lists as well. And so I would center in on the ones that you have. Now, yes, there are, if you see an allergy doctor, they may be able to devise something in regards to shots and other types of things that might eventually help. But in general, those that have severe nut allergies, I just tell them to avoid them.
Wow, wonderful. Lots of questions were answered, and our time for the questions is up. But if you still have questions and send them online, we'll get to you. We have been blessed, and we learned a lot tonight. And before we leave, we're going now to once again listen to
Improving headaches, etc. Well, it's certainly been my pleasure to be with you. I would also like to encourage you to learn more in regards to the other categories. We've had to center in on a few of them here, like frontal lobe and like nutrition, etc. But there are 10 categories, and the comprehensive approach is what produces the best approach. We don't leave any stone unturned in regards to trying to improve mental health. And by coming here to this series of meetings, you have entered the largest room in the world, and that is the room for improvement. And so review your own personal life and see what you can do to change your lifestyle habits to optimally have your brain functioning well and emotionally being able to be calm under the most stressful circumstances and still being happy with adverse events that occur in your life and having a sense of calmness and peace. Well, let's bow our heads as we conclude. Father in heaven, we thank you so much for the interest that you have in our bodies, minds, and souls. You came and you not only gave us life, but you have offered a more abundant way of living. And we thank you that you've not only revealed this information from inspiration and science, because we are reminded from the Bible that the first plant-based diet was the original diet that you gave to mankind, but that you do much more than that, that you are willing to enter into our hearts and transform us and give us your spirit of love, your self-sacrificing love, and your spirit of self-control. And we pray that we will not only learn this information, but through your Spirit be able to implement it through that freedom of self-control and self-regulation that you offer to every human being that opens their heart to your love. And we thank you for your interest in us individually as well as collectively. May this world improve as a result of this health summit. In Jesus' name, amen. Thank you.
Well, it's a pleasure and a privilege to thank Dr. Nedley for a really meaningful 3 evenings of balanced, evidence-based presentations, which can, if we choose, change the way we think, feel, and perform. What a blessing we've had. And now we can follow up, and we can read, we can make decisions, and we can investigate, and we can study for ourselves as well.
Yes, Dr. Nedley has 2 books that if you haven't bought the books yet, I'm sure they're going to have right outside in our exhibit hall, The Depression, The Way Out, and The Lost Art of Thinking. And Jaime Jorge, who was here and did this wonderful, beautiful piece, he is right outside with a whole lot of CDs waiting for you to come as well and able to share with you that if you don't have those yet, don't waste your time and you can enjoy this music at home. So we want to invite you to do that. And for those of you who are watching us online and those of you who are here, if you keep coming to our website, which is www.choosefullife.org, you're going to be seeing there follow-up events to this. Several of other events in the New York region or even around other cities around the country and the division of the North America. And we welcome you to follow up with us, be in touch, and we want to thank you for joining us for this series of Maximizing Your Brain Potential.
Thank you. God bless. Take good care.
Good night.
Bye-bye.